Discuss the recovery process and what you and your family can expect after surgery. The usual length of stay in hospital after cardiac surgery is about 4 to 5 days. The first 24 hours are usually spent in the cardiac surgery ICU, and the remaining time is spent on the cardiac surgery inpatient unit. After your operation, you will wake up in the cardiac surgery intensive care unit, or CSICU. This is the intensive care area that cares for cardiac surgery patients immediately after their surgery. You may feel overwhelmed when you first wake up, as there will be different noises and machines around you. Patients rarely remember the experience of waking up in the CSICU. However, we like to prepare you and your family for what you may see.
There was a person right there with me when I came to, looking after me. And that was, like I say, that was very comforting, just to know that I was being taken care of. They also gave me a lot of information about, this is what's going to happen to you now, Mr. Snyder, and this is what's going to happen, and you're feeling this way. One of the things that was a question for myself was, how long had it been since my surgery? Because I was given a timetable of, anywhere from 12 to 24 hours after your surgery, you will become conscious again. And it worked out for me. Of course, I was wondering what time it was.
When you first wake up, you may still have a breathing tube in. As soon as it is safe to do so, the breathing tube will be removed so you can breathe on your own and talk. You will also notice you have a special IV line in your neck and arm. This allows the nurse to give medications and monitor you closely. There will be chest tubes in your chest that are draining any extra fluid and any air that accumulated during your operation. There will be a catheter in your bladder, so you won't need to get up to pee. All patients will also have temporary pacemaker wires that are attached to the outer surface of your heart. These are used as a safety net. In the event your heart rate goes too low, the nurses are able to easily hook you up to a temporary pacemaker. These wires will be removed prior to leaving the hospital. All of these lines and tubes are placed when you are asleep during your operation and will be removed over the next few days of your recovery. We ask that families speak with the nurse regarding best times to visit the CSICU, as well as any considerations regarding number of visitors allowed. You will be asked to call in using the phone outside the CSICU prior to entering the unit each time. You will usually stay in the CSICU for approximately 24 hours, and then you will be transferred to the cardiac surgery inpatient unit, where you will recover for the remainder of your hospital stay. Some patients may need to stay longer in the ICU. Some reasons for a longer stay include low blood pressure, slower to wake up from the operation, having the breathing tube in longer, blood work results, chronic diseases, or a bed not being available on the cardiac surgery inpatient unit. Once it is safe to do so, you will be transferred out of the CSICU to the cardiac surgery inpatient unit, where you will recover for the remainder of your stay. Your experience on the cardiac surgery inpatient unit will be different than the CSICU. One of those differences is sharing your nurse with other patients, as each nurse on the inpatient ward is responsible for the care of about 4 patients. Please speak with your nurse regarding best times for your family to visit and any considerations regarding the number of visitors. On the cardiac surgery inpatient unit, you will continue your recovery along the recovery pathway. During this time, your recovery will focus on wound healing, mobility, gaining independence, managing pain, and preparing for going home. It is common to have some pain after surgery. The healthcare team will work with you to ensure you remain as comfortable as possible throughout your recovery. Some discomfort is expected after surgery. However, we want to make sure that we are managing your pain appropriately. Most patients find that extra strength Tylenol is effective for managing their postoperative pain. If you are unable to take a deep breath or your pain goes above a 3 out of 10, It is important to communicate that with your nurse. Recovery after cardiac surgery can be described as a recovery pathway. The recovery pathway outlines the goals and expectations for each day. There is a picture of the recovery pathway in your heart surgery journey booklet. The day of your surgery is considered postoperative day 0. You will be in the cardiac surgery ICU during this time.
After I first woke up, I got back to the ward and I went back to sleep for a few hours. After that, it was again as expected. When I first came to, checked on by nursing staff. Shortly after that, it was, okay, Mr. Snyder, time to get up and I want you to walk over to the chair. It was surprising because that chair was beside the bed, but boy, it looked like a long way away. So sure enough, walked over there, sat down, and I think unlike a whole bunch of other patients, the first thing that they asked me to do was to cough. That was not acceptable. They wanted real cough. And like they explained to me, we want to make sure that you're not getting fluid buildup in your lungs. All right, this is not going to be very pleasant. And it wasn't. It hurt a bit to cough, but that's the reality of being there. It's the same as the walking and getting out and walking so that I don't get clots building up in my legs and that sort of thing. As long as I knew there was a good reason for it, I bought into it big time. But I'm very much that sort of person who likes to know what's going on. The staff were excellent. If I had a question, they were very quick to respond by telling me what was going on. Like I said, if I'm bought into it, then fine. I think I must have bought into it pretty well because I followed the process very closely to what was directed. And as a result, I was released 3.5 days after my surgery. I figure if you do as you're told, it speeds up your release time.
This is when your chest tubes are usually removed. If safe to do so, you will be transferred to the cardiac surgery inpatient unit in either the morning or afternoon. Your incisions will be covered with a dressing. You may have a poor appetite initially after surgery. This will start to improve with time. Most patients are on a fluid restriction. Your nurse will let you know how much fluid you are allowed to drink each day. You will be encouraged to start transferring with assistance into your chair for your meals.
When they had to take the tubes out and there were other leads and that sort of thing, I was expecting to have a lot of discomfort or pain. That did not occur. It felt weird, there was no question about that, but no pain. And my experience throughout the whole post-operative thing was pain was a very unusual event. If I had to cough or sneeze, I definitely felt some pain. But other things like going for the regular walks that are called for, or getting up and moving around, or using the washroom, no, I had no pain whatsoever.
On day 2, the catheter in your bladder will be removed in the morning and you will be able to pee normally. Your nurse will continue to monitor your urine output, so you will be asked to pee into a urinal or collection container that is placed in your toilet. If you had bypass surgery, the dressing on your arm or leg will be removed and left open to air. If you have a leg incision, it will be important for you to be wearing clean underwear daily. The physiotherapist will see you on this day and will help you go for a walk outside of your room. He or she will let you know once it is safe for you to walk on your own, or if you will need to continue asking for help. You will be encouraged to transfer with minimal assistance into your chair for all meals. On day 3, the dressing on your sternum will be removed and left open to air. The temporary pacing wires will be removed if you have had no abnormal heart rhythms. After your temporary pacing wires are removed, you will be able to shower later that evening with assistance and supervision. In order to prepare you for discharge, there is a cardiac surgery passport located at the back of your heart surgery journey booklet. Please review these goals with your healthcare team. You will have discharge education provided to you and your family. The nurses will also provide you with our discharge teaching video to watch prior to leaving, which you or your family will also be able to view from home. You will continue to sit up in your chair for all meals and follow your mobilization plan given to you by your physiotherapist. You should be able to mobilize with very minimal or no assistance by this day. On day 4, the physiotherapist will assist you in completing the stairs. You will continue to sit up in your chair for all meals and follow your mobilization plan given to you by your physiotherapist. And day 5 is the usual day of discharge for most patients. However, some patients may be discharged earlier or later. Remember that everyone recovers at their own pace. Your family will be asked to arrive the morning of your expected discharge. We are usually able to provide your family with approximately 1 day's notice before your discharge, so they are able to make arrangements to pick you up. We will provide you with a copy of your discharge summary, discharge prescription, and will remind you of the follow-up appointments you will need to arrange.
Well, recovery after surgery is not going to occur overnight. For myself, who was relatively active prior to my surgery, it has actually taken me about 2 years to get back to where I was. But where I was I would hike up mountains on a regular basis. It took 6 months before I was really walking at a pace that made me happy. Now I'm looking at the same hills I looked at prior to my surgery and saying, yeah, I can do that one and I can do that one. And oh, I did that one just 2 weeks ago So I think the important thing is initially the recovery is going to be fast because it's going to be big steps that you're doing. But to get back to where you were is going to take time and work and some self-discipline. And I think if I'm any example of it, yeah, you do the work, you put in the time, you'll get back there.